Hello, everyone. Welcome to this amazing discussion that we're going to have today. It's an initiative by Leaders Lifting Leaders and sorry, Leaders Lifting Leaders, Navi Mumbai Circle, as we call it, and WICCI Future of Work. It's a collaborative initiative where we bring in discussions which are very relevant to women, and this discussion is truly relevant, obviously, because women of our age are going through this journey, or they are about to go through this journey, the journey of menopause. Now, working women especially have, uh, you know, to go through a lot of chaos during this time, because they are they are at leadership positions. They have to manage decisions. They have to globally travel. All of that put together, they have to manage their behavior very well. And on top of it, we are going through this physical and emotional turmoil, and that's when we need to understand this very deeply, be mentally prepared if we are not yet there. And this particular talk is also answering all your doubts and queries pertaining to menopause. I heartily welcome Dr. Varsha Ojha, whom I have associated earlier also, and we did quite a few talks on cancer awareness, menopause, etc. And happy to be back with her. She's incredibly talented doctor, and she works with the Prime Hospital in Dubai. Um, can we have Dr. Varsha on stage, please?
Hi. Good morning,
Hi,
Shweta.
good morning. Good morning, Dr.
Good
Varsha.
morning. It is such a pleasure to be there again with you, with your Learn and Grow series. And I was actually looking forward to these talks again, and it's my absolute pleasure to be here on this
So, Dr.
platform.
Varsha,
Yeah.
how many years of experience do you have as of now?
Shweta, I have an experience of more than 24, 25 years now
Wow,
after doing my residencies. So it has been quite a lot of experience. I'm in Dubai since last 14 years now. And before that, I've been
wonderful.
practicing in India. So,
Wonderful, wonderful. And I'm sure. So this, just to give you a brief, Dr. Varsha, that this is a, in very passionately, uh, close knit group that we have, Leaders Lifting Leaders, that I'm part of, and it is a collaborative event of Leaders Lifting Leaders and the other two entities. All three entities are women entities, so these are communities basically with for women, and these women are usually professionals, working women, and I'm sure that the discussion is going to be really enriching pertaining to menopause. So the stage is all yours, Dr. Varsha. I don't want to make this as a conversation. First, I would want you to share whatever you have to share. If need be, I will interject if there is any pertaining question to what you're explaining, so that it's very relevant to the audience. Over to you,
sure,
Dr. Varsha.
sure. Yeah, it's my pleasure, Shweta. I understand that your group is a big group of a lot of females. Some in the reproductive age group, some might be postmenopausal, and some might be approaching the menopause. So obviously, our talk would be relevant for all the age groups, I assume. So let's start with what is menopause. Now, menopause is basically the transition. It's a continuum of the transition of the aging of the ovaries. Uh, all females, they're born with a specific number of eggs in the ovaries, and the ovarian function, it continues throughout the reproductive age group. And gradually, as you approach the menopause, there's a transition of this ovarian function, and there is the depletion of the ovarian hormones, and the ovary gets atrophied, and the ovarian function gets depleted, and the female reaches the menopausal stage. Now, there are various stages of menopause. uh, to start with, the Average age of menopause is around 51, 52 years for all females. It can be early. It can be at the age of 48 also, or it can go till 53 also. And before that, there is a 3 to 4 years of climacteric, a perimenopausal state, when there is a transition. The ovarian functions, they start deteriorating. The ovaries are very important for females in terms of they give us the good female hormones, the estrogen and progesterone and the androgens. And when the ovarian function gets depleted, the ovarian function gets deteriorated, we are depleted of these female hormones, which have a very important role in our general well-being. Hmm? So 4 to 5 years prior to actually getting the menopause, you start getting those perimenopausal symptoms. And then we define it as menopause when there is a 12 months period of absent periods. And then comes the postmenopausal age. Now, why all this is important, Shweta? I think with increasing lifespan, the life expectancy of females, males, everyone has increased. Most of the females would go up to the age of 80, 80 plus, or even till 90 also. So now, more than one third of your life you're spending in your menopausal age. So, how will it affect your general well being, and what can you do to have a good transition, to have a uh, healthy lifestyle? We can just focus on that. Now, the ovarian hormones, the estrogen and progesterone, they are basically responsible for the general well being of the females. They have an effect on your skin, your hair, your nails. They are important. They release the good neurotransmitters in your body, so they're responsible for a general well-being for the females. The sexual life is affected by the hormones, the estrogen and progesterone. They have a protective effect on your bones. They have a protective effect on your cardiovascular system. So all these will get affected when you reach the menopausal age, when the effect of these hormones is going away from your body. Uh, the symptoms, they can be uh, the acute symptoms, the acute onset, then there can be the medium range symptoms, and then there can be the long range symptoms. Uh, how do you manage these symptoms? One is, yeah, the symptoms can vary in frequency. Not necessarily every female will experience the same degree of symptoms. It may affect the quality of life in a different way for all the females. Not necessarily everyone would be affected to the same degree. It also depends on how you perceive the menopausal symptoms prior to reaching the menopausal age. If you take it more positively, probably you'll be able to bear the changes in a more smooth direction. As far as the acute symptoms are concerned, the most common symptoms would be the vasomotor symptoms. Vasomotor is hot flushes, sleep disorders, and more of anxiety, panic attacks, which can go to the extreme actually sometimes. So the vasomotor symptoms, they can also vary in degree. Some people, for them, it might be easier to bear these symptoms. For some, it might be more difficult and might affect their quality of life to a more significant extent. And the treatment also depends on how the females perceive their symptoms and to what extent they are getting those symptoms. Uh, the next is the which affects to a great extent all the females would be the urogenital atrophy. The urogenital atrophy is when, because the estrogen hormone, it has a protective effect on your mucosa, the vaginal mucosa. These females, after menopause, there is more degree of vaginal dryness, vaginal infections, increased urogenital infections, uh, reduced sexual desire, reduced libido, difficulty in having sexual intercourse, which can actually affect the females to a large extent because they're not prepared for these changes. Now, how do we manage? I'll come again together. Next is the protective effect of the menopausal hormones, the estrogen and progesterone on your bones and your cardiovascular system. These are the long term effects of menopause. So, with menopause, gradually the bones also start becoming weak. there are more chances of osteoporotic bone fractures, osteoporosis, osteopenia in females postmenopausal. And the cardiovascular health also depends upon the estrogen and progesterone. They have a protective effect on your heart, and you don't hear about strokes and uh, ischemic heart attacks in females at a younger age. Usually, they affect the females after menopause. So these hormones, they have a protective effect on your heart and bones. Now, coming to the another thing which is very important, Shweta, as you said, is that yes, we all are professionals, and we are at the sometimes we are at the peak of our profession at these stages. If you look at the doctors also, most of the times they will start growing at this age. After 45, 50, you actually start growing into your profession. And at that age, the absence of estrogen and progesterone and the menopause actually has an effect on the mental health also, which is a very important point to be discussed. uh, there is increased chances of brain fog, loss of concentration, difficulty in doing your day-to-day activities and concentrating and focusing on your work, increased chances of having sleep disorders. Sleep disorders obviously will have an effect on your routine activities, on your quality of life, increased chances of having anxiety attacks, depression, which might vary in frequency from mild, medium to moderate, and will be managed differently according to the degree of symptoms the females are having. But these are the common symptoms which can affect your professional life, your social skills, your interpersonal relationships, changing body image, aging. All these factors, they will have an effect on the mental health, which has to be dealt with great degree of sensitivity. Now, coming to the medium range symptoms like vasomotor effects, the hot flashes, and all, uh, they may last. They can be self-limiting also. Not necessarily they will last throughout your life after you have achieved the menopause. They may, most of the times, it would be up to 3 to 4 years, but yes, they can persist up to the age of up to 12 years also. Hmm? If you have severe degree of vasomotor symptoms, the treatment would be hormone replacement therapy. The treatment is given to female depending upon the degree of symptoms, how much it is affecting your quality of life. Not necessarily, as I said, everyone needs the treatment, and not necessarily every female is fit to take the treatments, the hormone replacement treatments. The hormone replacement treatments are given in the form of hormones. There are non hormonal medications also. There can be cognitive behavioral therapy, lifestyle interventions. There are other factors which affect the degree of menopausal symptoms, like smoking, alcohol intake, and more BMI for the females, high glycemic index, food intake. So, lifestyle modifications again is the first line management for any kind of menopausal symptoms, also. Uh, quit smoking, reduce alcohol intake, do regular exercises, dietary control, because exercise also produces the good neurotransmitters. It will help you in going through that phase more smoothly, and getting a better quality of life, and less menopausal symptoms you'll be able to have if you're doing regular exercises and meditations, yoga. All these things can help. And at the same time, I think the positive attitude towards the changes which are happening. uh, don't be scared of the changes, because menopause is inevitable. At the end, each and every person is going to face this. It can be little early, it can be late, but everyone has to go through those transition. And if you can make that transition smoother for you by the lifestyle modifications, nothing like that. Now, if the symptoms are too extreme, and if it is affecting your quality of life, then yes, you need to go to your doctor, get a proper consultation, and depending upon your history, your medical history, history of any other illnesses for you, history of any medications you are on. The doctor can prescribe the hormone replacement treatment for you. It can be hormonal and non-hormonal. Hormonal treatment is in the form of estrogen and progesterone. And for reduced sexual desire, testosterone also can be given to females. The estrogen and progesterone hormone, which is given, it can be in different forms. It can be an oral treatment, it can be a gel, it can be a transdermal application, depending upon uh, your history, any medications if you are on, if you are extremely obese, if your BMI is more than 35, then you're not the right candidate to take the oral hormone replacement treatment. It increases the chances of complications like thrombosis in your veins, venous thromboembolism. So the doctor would prescribe you a transdermal application. Uh, if you are on any other medications like anticonvulsants, antidepressants, then also you will have more side effects. If you take the oral medication, you can take the transdermal applications. If you have more of urogenital symptoms, the vaginal atrophy, you are the right candidate to take the vaginal gels and creams, which will help you in relieving you of the symptoms. Whenever you are taking these hormone replacements, then there are non-hormonal treatments also like tibolone. There are non-hormonal treatments like plant-based estrogens. You can get plant-based estrogens from isoflavones, phytoestrogens, and they can help you with your symptoms, especially the vasomotor symptoms. Now, the treatment, if you started this hormone replacement treatment also, you should understand that this is not something which is over the counter available for you. You should always go to your doctor. Uh, they will explain to you about the risks and benefits involved. Not necessarily every treatment is suitable for you. And after discussing the risks and benefits, you come to a conclusion and you start with some treatment, which definitely needs a close follow up. Follow up after 3 months to see how much it is affecting you, how much it is helping you, and whether you are getting any side effects. And then you should do a regular annual checkup and make sure that you don't have any major side effects. Another thing which is important is yes, the hormone replacement treatment, if needed, it should be started as early as possible. And you don't continue it lifelong. You can take it for a period of shorter duration. You can take it for a period of 5 years or 10 years. Best is if it is started before 60, then it has a protective effect on your cardiovascular system. It reduces the risk of stroke and all. But if it is continued beyond the age of 60 years, it can have more side effects than benefits. Then another thing which is important for the bone health, see, these hormone replacement treatments will not help you with your muscle mass and all. So for that, you definitely need to do regular exercises, strengthen your core muscles, swimming, low impact exercises, very important. For females who have a very low BMI, means they're very lean and thin, BMI is less than 20, BMI is less than 22, uh, they should take a regular calcium intake also, at least 1 gram of calcium daily. If you have vitamin D deficiency, you should take a regular vitamin D supplementation. Even if you are not deficit in vitamin D, you can take the maintenance dose. It will help you in building and strengthening up your muscles, and that will help in protecting your bones from osteoporosis and osteoporotic bone fractures. Now we come to another very important topic, which is getting more and more common these days. That is early menopause. Now, the right age of menopause, definitely anything after 48, 50, 51 is the average age of menopause. But some females, and it is getting more and more common these days, they get menopause very early. Uh, if you have menopause before 40, then it has extreme effect on your general well-being. For such females, definitely they need to start with the hormone replacement treatment, which can be. So the premature menopause is less than 40 years of age, and they should take the hormone replacement treatment, maybe in the form of the oral contraceptive pills also, and they should continue it till the natural age of menopause because it will protect them, it will protect their bones, it will protect their heart, and it will give them a general sense of well-being, and it will protect their skin, the sexual desire, the libido, everything else is very important. All females, they are born with a fixed number of eggs at the time of birth, and gradually every time and every time with your menstrual cycle your body is depleted of those eggs, so the fertility also it reduces gradually, and it is much less after the age of 35, and then gradually it reduces more and more, and the quality as well as the quantity of eggs, both of them will deteriorate after a certain age. Now, those females who have a premature menopause, or if they have a premature ovarian deficiency, like the ovary, it becomes less efficient, less functional. They have all these changes much, much earlier. At the age of 31, also, those who are affected by premature ovarian deficiency, they might have much less eggs as compared to the females who have the menopause at the natural age. So it's very important to include these studies about the reproductive health, about the fertility, about the menopausal symptoms, about early menopause, about the ovarian deficiencies. I believe this should be a part of the school curriculums also, so that there's an increased awareness. And in females who are at high risk of ovarian insufficiency, maybe because of the family history, maybe because of some treatments which they have undergone, like cancer therapy or treatment of endometriosis, in which the ovaries ovarian function is lost. These females, they should be aware of the reduced fertility at a younger age, and then they can opt for the different measures. They can do the cryopreservation of the eggs, which can help them in achieving fertility in the later age. And now, there are some patients whom we cannot offer the menopausal hormone replacement treatment, especially females who have a high risk of hormone based cancers like breast cancer, ovarian cancer. Such females are not the right candidate to take the hormone replacement treatment, not even the plant based estrogens. If they have extreme degree of symptoms, they should always consult a proper menopausal doctor, menopausal consultant, and get it evaluated and take the treatment which suits them the best for the shortest duration of time. Now, the treatment may vary in females who have a uterus and who don't have a uterus. If you're taking, again, I would stress, if you're on any hormone replacement treatment, you should understand that you cannot take it lifelong uh, without any follow-ups. Yeah, Charu, I'll get back to you with the symptoms of early menopause. But so the any patient who is taking the treatment, and if you have a uterus, the hormone replacement treatment is given in the form of both estrogen and progesterone hormone, because estrogen alone can cause endometrial hyperplasias, it can cause endometrial cancers. So any patient who has abnormal uterine bleeding and is on HRT should get her transvaginal scan to check the uterine linings. And if there is any suspicion, then she should get it evaluated by doing the procedures called hysteroscopy DNC to rule out any endometrial pathology. And progesterone is very important when you are having a uterus in place. As far as the symptoms are concerned for premature menopause, again, I said Again, I'll tell you that yes, if anyone who has a significant family history of premature menopause, who has undergone some procedures related to the ovaries, they have stage 3, stage 4 endometriosis at an early stage, and they have got themselves treated for that. Anyone who has had any surgeries, maybe ovarian cancer, you don't know, or dermoids, when you do the surgery on the ovary, then or who have had any radiotherapies, any chemotherapies for any other disease, then also the fertility might reduce and the ovarian aging can be early. uh, Smoking is a very important factor which is related to early aging. So quit alcohol, uh, um, decrease alcohol intake, quit smoking. This will help you in preventing. As far as the symptoms are concerned, yes, early period irregularities, severe oligomenorrhea means the period duration and quantity is reducing gradually. There's an irregular delayed period for you. That polycystic ovarian syndrome patients who also have very much irregular delayed periods. Uh, and you do the AMH levels, you're not able to get pregnant. And the AMH levels, AMH is anti-Mullerian hormone, which is an indicator for ovarian reserve. And the ovarian AMH levels are very low in females who are likely to get early ovarian insufficiencies. So, support group, there are different support groups, and we can actually get into it. I think with this Learn and Grow series also we can make more support groups for menopausal females and work towards it. And I'm open to any uh, questions from you, Shweta, because if I've missed something, we can discuss more. You are not audible, Shweta.
Thank you, Dr. Varsha. It was pretty comprehensive. Uh, there are a few questions, and a couple of them I think you've already answered. Is IVF treatment safe till what age?
Uh,
Or
See,
the delayed
IVF
age to
treatment,
menopause, I
yeah,
guess.
it's not directly related to menopause, but they are very close to each other. Uh, as a clinician, as an obstetrician, uh, I would actually love to talk on this topic because we see so many patients these days. Uh, Deliberately, we are. That's why I said we should include this in the curriculum at the school level, about fertility, the age of which age is which age is right to conceive, which age is right to marriage, what are the complications which are associated with late marriages, late conceptions, late fertility. IVF treatment, earlier the better, because the success rate depends upon the age of the patient. Success rate depends upon her ovarian reserve. If the ovarian reserve is good, more likely that you will have a successful IVF pregnancy. Then, not only the quality of eggs is reduced with increasing age, it is the quantity. I mean, not only the quantity, it is the quality of eggs also which reduces with increasing age. After 35, more chances of having babies with chromosomal abnormalities, more chances of having babies with Down syndrome. It's it's difficult to digest because 35 plus pregnancies are getting more and more common. People are deliberately shifting their age of conception to that age. 40 plus, the risk of having babies with chromosomal abnormalities is quite high. I mean, it goes in the range of 1 in 100. Like 100 females who conceive after 40, one of them might have a baby affected by Down syndrome, or other chromosomal abnormalities, might have a baby affected by autism. So we should spread this awareness. So earlier the age is better. And nowadays we say that if there is no known reason for infertility, anyone who is trying to conceive for more than 2 years and there is no reason, uh, there's no reason diagnosed for infertility, then IVF should be an early option for them. So more chances of having a successful IVF pregnancy and a healthier outcome.
So there was
Because
another
hmm,
question. I think this is answered. Anything else you would want to add? I just interjected.
symptoms of early menopause.
Yes,
Symptoms of
I
early
think we
menopause would be, as I said, yeah, period irregularities, extremely delayed periods, severe oligomenorrhea, and family history, and then your lifestyle, excessive stress levels, smoking, alcohol, uh, all these can cause even socioeconomic status, income, stress levels, all these things also are related to the menopausal age. These can advance your obesity can advance your menopausal age, and these factors can make it earlier. uh, Hot flushes, mood disorders, insomnia, sleep disorders, all these would be the symptoms of early menopause.
okay. Okay. So
So
Gauri
whenever
has
there is any doubt,
yeah, please continue.
whenever there is any doubt and absence of periods for more than 6 months, 1 year, at an early age, you do the FSH levels. FSH is the follicle stimulating hormone, which is released from the brain, and it is released in response to, it is suppressed when your ovaries are working well. So when the ovaries they stop functioning, the FSH level rises. So FSH level more than 35, 40, not a single reading, but two readings over a period of 4 to 6 weeks will indicate that you have reached the early menopause. And unfortunately, once there is you have reached this menopause, the ovaries have stopped functioning, then you are not the candidate for IVF also, because the ovarian reserve is gone. You cannot do IVF in postmenopausal females. So we have
So
patients who have had early menopause, and they have, unfortunately, uh, they have postponed their fertility and their family life, maybe because of other pressures. And then, unfortunately, you cannot do anything about it after reaching a certain stage.
So one very pertinent question, and in fact, sometime back I wrote about it also, is how since a lot of female employment is generated nowadays, and leaders in leadership position we have women. Gauri has asked a very pointed question, and which is like, how can organizations support women during these difficult periods? What are the things that, in your opinion, they can take in terms of, because she is a HR person, so maybe a shout out to the HR fraternity and employers in general, what they can possibly do
Uh,
to support this.
uh, yeah, definitely, we should have support groups for this, and we can have more talks like these, which are actually creating awareness. Uh, we as I said, we should have a positive attitude towards menopause, because this is inevitable. These changes are bound to happen to everyone. And you should take out time for yourself, at least 1 hour per day, in which you do your things which you like. You Things which you like doesn't mean sitting on the sofa and watching television, but you can get into some regular exercises, and dietary modifications are very important. You take care of your health, and at the same time, uh, when you have these kind of awareness talks and encourage uh, the the male members also to participate into these talks, then and promote them more on the social media, probably it will create the awareness amongst everyone, amongst the other members of the family also. And at the same time, we have to take care of ourselves. We have to take care of the diet what we are having. You take food which is after a certain age, you cannot have the same kind of diet which you used to have at the age of 20 and 25. So you need to focus upon the changes which you can bring in your lifestyle, which will bring a positive attitude. Have a good sleep, proper sleep. regular exercises, uh, good food, lot of fresh fruits, vegetables, the plant-based products, beans, broccoli, uh, soya, which is very good for plant-based estrogens. All this can help you in getting over the menopausal symptoms, and do activities with your female counterparts. Engage into
So,
that as well. Who will be
do you
probably
bel
more understanding.
do
Yeah.
you believe doctor counseling sessions can be of help on a regular basis for the force in that menopausal category as an organizational
I
support?
think so. I think so. Honestly, my OPD clinic, half of the times I'm doing these regular counseling sessions only. And there are patients who are very happy to meet me, so they just come to me for regular counseling only for any kind of problem they have. So it helps with these symptoms also. At least you understand your body. There is so much of changes which happen with the menopausal transition, the changes in your sexual life, the body image. So any patient who comes and talks to you and gets an understanding about your own body, about the changes what are happening, you have an understanding that okay, this is happening to me, and now I can do this to control it. This should help.
So, a very pertinent question, and something that I have also felt, that how to make family members understand this. Because when we try and explain it to them, they are like, "ये फिर से menopause वाला एक excuse है to just get
Hmm.
away with things." So, how do you make them understand? Like, awareness is one, but like, they should
I
participate in
I
that awareness. But how
they
do you
should
make them?
participate in that awareness at one place, and then I doubt that you can make everyone understand all
So
your
you have to live
problems.
with.
So you have to live with it, and you have to bring positivity from other aspects, so that if you are positive, they are happy. They because no one would like to stay with a negative person for a very long time. This also is a fact. If you're suffering from any disease, also any major disease, uh, at the end of time, the people around you sometimes may get tired of it. So this is something which you understand about your body, that okay, these are the changes which I'm facing. And I believe, Shweta, I think exercise is one thing which really brings out good neurotransmitters. Listening to good music, eating good food, healthy food,
And I
lot
think
of fresh fruits,
it's
vegetables, all these things really make a difference. Stay hydrated, take lot of liquids, and talk to people.
so
That is
very
also very
underrated,
important.
very underrated. But what I totally concur this, because it, as an outcome of all this, eating the right kind of food, enjoying things that you enjoy doing, exercising, as an outcome, you really see yourself in good shape, and that also creates a positive mental framework, so to say.
Hmm.
So, and you're also strengthened from within. So, considering leaders in decision
Yeah.
making, the kind of workload that they have. One last question: any supplement suggestion that you would recommend?
Hmm. Calcium supplement, 1 gram of calcium daily, vitamin D supplement. If you're worried about your hair, nail, skin, you can take biotin. It's good for hair and skin. Collagen supplement. There are collagens for bone, there are collagens for skin, hair, nails. You can add it to your this thing. The plant-based estrogens, as I said, the phytoestrogens, isoflavones, but not all the females would be the right candidate to take them. Yes, you can have soya, you can have red beans, you can have chickpeas, broccoli, all these things they are rich in estrogens. But the females who are cancer survivors, breast cancer patients, sometimes they cannot take these plant-based estrogens, all the supplements which are available, monoflavones and all. So they have to manage with the other lifestyle measures only. But I think these supplements are okay, and then depending upon if you're deficient in something, if you have iron deficiency, you should take iron supplements. You should eat food which is rich in iron. If you have B12 deficiencies, you should get that evaluated and take the supplements accordingly. Get regular health checks done after a certain age. Regular pap smear, very important. If it's normal, you can repeat it in 3 years. If it's abnormal, then you need to do it early, depending upon how much abnormal it is. If you have any abnormal bleeding, especially in the postmenopausal age, get it evaluated, get the ultrasounds done. Even in the perimenopausal age, if you have very heavy bleeding, get it evaluated. More likely, there are chances of hormonal imbalances, which can cause uterine cancers. So, all that has to be taken care of. At the same time, Shweta, at this stage now, it has been 4 years, so I don't mind talking about it. I mean, I might be a little reluctant to talk about it before, but I am a patient of CA breast. I took all my treatments in 2020. I was 47, 48 at that time. And when you take the treatment, they give you all the hormones to suppress your ovaries. You actually enter into a menopausal state. Initial 1 or 2 years might be a little difficult, but gradually, as I said, when you start understanding your body and things do improve over a period of time. If you have more positive attitude, uh, it really helps in getting over it, even without the hormone replacement sometimes. But if you have very severe symptoms, if you have severe anxieties, if you have severe depression, if you have severe mood disorders, you are not able to sleep properly, uh, you have extreme degree of symptoms, you should not hesitate in going to a doctor and getting the hormone replacement therapy which is suitable to you. For extreme degree of symptoms, sometimes you might need anti-anxieties, antidepressants also. You may need a help from a psychiatric psychologist also, who will give you the treatment which suits you the best.
So, I have a very pointed question. There was a question which possibly we have answered in very many ways: how to cope with mood swings during menopause. Now, like obviously, we have spoken about it in terms
HRT
of,
can help with that also. HRT can help with mood swings also. HRT
but
can
like,
hormone
how
replacement
do you,
treatment.
yeah,
Hmm.
how do you identify that you have gone to that extreme? Like, the
There's
extreme
no
is very
extreme.
subjective.
There's no extreme. Yeah, it is subjective. It depends on how you perceive your symptoms. If you are not happy, if you're not comfortable, if you feel that you are getting extreme degrees of mood swings, um, if you're getting those extreme degrees of mood swings almost daily for a period of 2 weeks, hmm, that is a
Okay.
criteria that yes, you should seek help. Don't
Okay.
bear with it. HRT is available. It is a very good option. Anyone who
But
has symptoms and
there
who
is a
is not able,
misconception
hmm,
amongst general public that anything with which has to do with hormone replacement has multiple side effects in very many ways.
no.
So no,
If it is
thank you for
taken in a
pronouncing
good,
it.
yeah, if it is taken for after ruling out all the side effects, after ruling out all the risks and all, and see, any patient who has diabetes can take HRT. Patient who is extremely obese, 45 plus BMI, we might think, but still 35 plus BMI, you can, one is weight reduction is very important, and then you can think of giving HRT in a transdermal patch. Any patient who has extreme degrees of vaginal atrophy, take HRT. Hot flushes, vasomotor symptoms, sleep disorders, anxiety, they are the candidates who should take hormone replacement treatment. You cannot take it lifelong. You need to stop it after a period of time, but you can take it till the age of 60. And most of them can take it at the till the age of 60 very safely. Only thing is you need to be cautious and you need to have regular checkups. You need to go to the doctor every 3 months and then annually and see that you don't develop any side effects related to the hormone replacement. But it is a safe treatment to be given.
Great.
Much safe
Uh,
than going through the side effects and the much safe than going through the symptoms and signs of menopause.
Very good. So a lot of myths busted there. So we come from a school of thought, Dr. Varsha, that we need to bear, and ये तो सबके साथ
You
होता है.
don't have to bear. You don't have to bear at this age. Even uh, not necessarily you have to reach the age of menopause and the perimenopausal age also. If you're getting extreme symptoms, the only thing is, yes, if you have a uterus, you cannot take estrogen alone. You need to balance it with progesterone. The progesterone can be in the form of a Mirena IUD, which goes into the uterus, so it protects your uterus against uterine cancers. And then you take the estrogen supplement along with that. It can be a transdermal patch, which is very safe to take, much safer than the oral medications. And there are other medicines also which are available, which are good for all these symptoms. It is called Tibolone, which is good for vasomotor symptoms and per se. And most of the menopausal symptoms, even bone will be protected if you're taking hormone replacement. Your heart is protected if you're taking hormone replacement. It doesn't increases the muscle mass, so there's no alternate to exercise. That is very important. But rest of the things they'll take care of.
So, Sneha, is there any sign that shows you are near to menopause? I think we've covered that. So, you please go through the um video again. So, you would be able to, all those questions would be answered, I suppose. Any other question that we may have? I'm just looking at multiple channels we are live. So, anywhere, the questions are coming up. I This is really engaging, Dr. Varsha, and thank you so much for taking the time out. And I believe that fertility is one topic that I will highly recommend leaders, lifting leaders, to facilitate
I
that, and we can have
I
Dr.
believe
Varsha again.
we should talk about a few topics, Shweta. One is yes, fertility, the age of fertility, the complications which are related to late conceptions, the complications are which are related to obesity in pregnancy. All these are highly pertaining topics, and we should focus on all these topics of women health gradually.
Wonderful. Any last words that you may have?
Last words is I wish
Be
graceful
happy.
aging for be happy, seriously, be happy. And you are very close to me, you know me very well, and you know me inside out. So, this is the only thing. Be happy and be positive, and that's it. Don't
So,
allow
what I
negative
feel.
people to be around you
So within
or help them. Hmm.
I believe I have not been part of high, big corporates. But what little experience that I have, I've experienced that colleagues still, you're kind of extended family in a way if you worked for so long, and you open up. In my case, I always deal with clients, and whenever I have this, downtime, so to say, and if I have a client call, I start with that, hey, I'm low on energy today because of XYZ, and I own it unapologetically. So I believe that leaders who are struggling there, I think you can take a cue from here, and just pronounce it, so that you people
Hmm.
can't second guess with women that what they're going through. Is it ghar ka problem? Is it this? Is it menopause? Is it periods? Is it not periods? Whatever it is. So it's good that we pronounce it to our male counterparts, and make them aware that this is a situation, guys. Please bear with me for a while. And I think that helps. In At least it has helped in my case. So brilliant. Thank you. I'm
Thank you
sure
so much.
that
Yeah.
women across would watch and rewatch this, and take help from it, and make their male counterparts also watch this, so that they get more awareness. And I'm sure all of us are going to come back to you with more pertaining topics very soon.
Sure.
And thank you for taking time out.
Thank you
All
so
of you
much,
all,
Shweta.
have a
Thanks a lot.
happy, healthy, and a great weekend. Thank you.
Thank you. Have a nice day. Bye.